few patients. Here we go. everyone. It's Friday, August the 14th. I have 4 more great West Virginians to report to you that we've lost. We lost as our 154th death. We lost a 77-year-old female in Logan County. 155th death, an 84-year-old female in Logan County. 156th death, a 73-year-old male in Logan County. And our 157th death, a 97-year-old male in Mercer County. We said all along we were worried. We were worried about this terrible killer coming from the south. And in many of these cases, it really didn't come from the south. We brought it back to us. And so that's a real concern, and it's a real concern for any of y'all that are going, especially to Myrtle Beach. You know, it is an issue that we're looking into, and we're probably going to address more stringently, you know, early next week. Yesterday we had 118 positive cases. Before I go there, again, I want you to please let these 4 great West Virginians not go unnoticed and not just fade away, surely not become a statistic. Please keep them in your thoughts and prayers. Our daily positivity rate yesterday was 2.33. We had active cases of 1,973. That's up from 1,895 on Wednesday. If you'll remember, those cases have been just bouncing back and forth between the 1,800 and 1,900 level. And so we just got to continue to keep watching this. You know, our number of hospitalizations is exactly the same as it was on Wednesday. You know, we keep saying just this, and our great people that we got with me today will be talking here in just a few moments, but we have tested a lot of people in the state of West Virginia, and that's good stuff. Our reproductive number, our RT number now has popped back up just a little bit. We were the 5th best in the nation, now we're the 9th. It's at 0.92. I think that jumped back from 0.89. Still a pretty good number, you know, you know, I guess the biggest news of the day is, you know, to go to all of how we're going to move into our green, yellow, orange, and red coding system for our state. The first thing I want to do is do this. I want to tell you that we've been working on this night and day for a long time, with all the experts that I know how to gather together, you know, whether they be experts from out of state, you know, that we're all listening to and referencing, you know, the performance of the out of state people, you know, across the world people, from the standpoint of our medical teams and everything, from the local level all the way up through the state to even to our czar, Dr. Clay Marsh, to all the education community. You know, all the way through the education community, from our teachers to the input, you know, of all of our superintendents that are doing phenomenal work on a county basis, all the way to our state superintendent and our state board, and and our state superintendent, you know, Birch is with us today. You know, but nevertheless, you know, the other thing is if we'll step back and look at the great work that they've done, and let me just go through it now with you. You know, there's no state that we know of that has a rating system that is similar to what we're going to propose to do. Our rating system is going to evolve around a 7-day rolling cumulative positive number, not on what has happened since March or whenever we started, you know, calculating our positive cumulative average, you know, and so, but it will start on a 7-day rolling number. And each county in our state will receive a code, basically either a green, yellow, orange, or red code that will change daily. Now, if you're orange, it's going to be surely easier for you to get back to yellow than it would be for you to go all the way back to green. So it's not going to change that significant and that drastically, but the biggest thing you need to try to do with all in you is to try to stay in green is where we want everybody. But if we can have everybody in green and yellow, that is absolutely good. That's exactly what we want to do. Now, the numbers that we'll be using for that are, if you have, and this all will be based on a population basis in the county so that it's not skewed for counties that are, have a great many more level of population. But but it will be based on 100,000 people population as a percentage basis. Surely we don't need to think about you've got to have 100,000 people in a county to qualify or to get a number or whatever it may be. It will only be based on 100,000 people to develop a percentage basis. But if you have a rating of either from 0 to 7 per 100,000 people on that basis, you will be ranked as green. If you have from 8 to 15, you will be ranked as yellow. If you have from 16 to 24, you will be ranked as orange. And if you exceed 25, you will be red. To give you an idea of a comparison, the nation today is tracking at about 16. Now that barely gets you into orange, but we want to be better naturally than what's going on in Florida or Arizona or Texas or wherever it may be. So, we've got to get better than those numbers, but only slightly better. That would put you in the yellow or hopefully all the way back to the green. Now, if we go red in any county, that county will automatically go 100% virtual. Now, there's a few little twists here. From the standpoint of if you are orange or red right now, and it would happen to be days before the opening on September the 8th, you will not open until you get to yellow or green. Now, the reason we've done that is just this. We don't want to set you up for automatic failure. And we think if you're in the orange, you've got to get yourself out of the orange in order to be able to have extracurricular activities or to open the school safely. That's what we feel like that needs to be. And so if you're orange or red, you will not open until you get below that, and all the teaching will be virtual. Now, once you drop below that, or you are yellow and green, and we start, if you move back into the orange category, let's just say it this simple. If you are yellow or green, and you move into the orange category at some point in time, let's say October the 1st. At that point in time, we will not allow sports competition to take place. We will continue to allow sports practicing in a model that has come out from the SSAC, and it will come out similar to that of the trial basically that we ran in the summer. Where what we did was we did so much conditioning, then so much separation, then so much actual contact with one another, and then so much conditioning. So we will follow that format or some metric of that format if you drift into an orange category as the season goes on. Now, so If you are yellow or green, right off of the get-go, we're going to permit and go forward with not only school, but our athletic competition as well. Now, from the standpoint of our private and Christian schools, basically, if you do not have athletics there, at a school, then all you really need to be concerned about is the county going red. If the county goes red, we have no choice but to shut you down as well. And the reason for that is just really simple. If the county is blazing red, we got to stop it. We got to stop it everywhere, and we got to take away any possibility that there could be an incident come from your school as well. If you have sports at your school and it's a private or Christian school, you'll follow the same guideline. And that will be if you drift from a green or yellow up into an orange category, you'll still be allowed to practice and do all that. You'll still absolutely be, continuing school. We will not stop school and by going into the orange category for anyone. But athletically, you will absolutely not be able to travel and play in direct competition. You will be backed off to a metric that the SSAC will give us, and you'll go through a practicing or conditioning and everything until your county can drift back down out of that orange level. Every Saturday night at 9 o'clock on Saturday night, we'll be posting we'll be posting at that point in time the rolling numbers that we will use to dictate and to rule over the next 7-day period. So as we move forward, let's just say that you're in the orange, you're in the green or the yellow, and then on Saturday night you drift into the orange category. At that point in time, you can't actively play competition until you pull back down into the yellow and green. So from the standpoint of, let's just say we posted this number, let's just say that in the middle of the week, on the rolling average that you're watching every day, in the middle of the week on Wednesday, you noticed your county had drifted into the orange. You'll be allowed to play games until the weekend on Saturday night because we can't put it together any other way. The scheduling is too difficult and everything. And let me make it even more profound. If on Thursday you drifted into orange and on Thursday night you were playing, or on Friday you were playing, can you just imagine how that would just disrupt everything? So what we're going to do is, if you drift into orange, we're going to allow you to play until Saturday night at 9 p.m. And then from that point forward, you'll have to get yourself back down into the yellow and the green. Now, what happens if on Wednesday your county goes to red? If it goes to red in any and all situations, immediately at that point in time, not only will all sports activities stop, but school will stop as well, and we'll go 100% virtual. Now, we have a map that we're waiting on from the DHHR right now, and we don't have that map to show you, but everything will follow a map, and every reference will follow a map with every county on the map. Now, that map we don't have right yet, but today, if we had that map to show you today, what we would show you is Logan County would be in the red. We would have 2 counties in the state in orange, and they would be Mingo and Grant counties. So if we were going back to school tomorrow, Logan, Mingo, and Grant County would be 100% virtual, and that's all they could be. Now, also I want to say one more thing about Grant County, and it's just this. It is the interpretation of how these outbreaks are done. We're all concerned about one thing, and that's community spread. Everything is community spread. When we have an outbreak in a nursing home, or a correctional facility, it doesn't necessarily involve the entire county, and it would be unfair to give the county a red rating because of a situation at a correctional facility or one nursing home. So here's what we're going to do there. We're going to rate the inmate or the residents of a nursing home facility or that type of facility as a 1. So if we have an outbreak of residents at a particular nursing home, they're going to only count as 1 in the county, green, yellow, orange, red calculation. And the staff members, however many staff members are infected, are going to count at 50% of the level of the total staff members. So in other words, if there were 40 staff members, that were affected, 20 would be your number that you would use. Now, the reason we do that is to try to make it not become biased or not become skewed. Now, just remember all this, that everything that we do in regard to schools is basically centered around the county rules. The counties, the superintendents and the counties are the ones that are coming out with the variations, whether it be hybrid, whether it be, fully virtual, or it be school. Now, stay with me and just think about this because it's been complicated, I know. But if you're in a county and that county's green and the school's opened and absolutely, you're encouraged and to take your child to school, and you don't want to take your child to school, that's fine. Remember all the time that locally, the local superintendents in each county have put together programs that are 3 ways. They're in school, completely virtual, or a hybrid. Your choice, parents, your choice to how you want your kid to be educated is your choice. And that's why we have the 1,000 points of light, the wireless stuff that's all going up like crazy right now. And that's how we're trying to get set up to give you more flexibility to the parents. We're going to give, the local counties surely have more smarts about what's going on in their county than we have in Charleston. So they will be making up, the guidelines and everything for their county. But you will have three mechanisms to go, even in a green county. Now, what do we do in a red county? In a red county, you only have one mechanism because the school will be closed. The only mechanism you have is just simply to go 100% virtual. So that's how all that will fall into place, and that's how everything will work. And to go back real quickly, I would just say every Saturday night we'll be posting the map, from the standpoint of how we're going to regard extracurricular and everything. We'll go with that map on Saturday night. As far as if we ever go red, at that point in time, we do not continue to play for a couple of days. If we ever go red, we shut everything right down. From the standpoint of our private and Christian schools, if we go red, you're going to have to shut down. If you have sports and everything there, if we go orange in the county, you're going to have to go to practice only and not competition. I think I've covered everything there, and I'm sure we'll have questions, and we'll go on to those in just one second. But again, I can't thank all those that have worked really hard, whether it be DHHR or the Guard or our Department of Education, our czar, Dr. Clay Marsh, our medical community, Dr. Amjad, and, just so many different people, all the way down through all the local medical and local county health, and everybody. You've done a really good job putting this together. I know it's a little complicated and everything, but we've tried to make it completely transparent. Again, West Virginia is on the brink of doing something from a pioneering standpoint that others have not done. But this absolutely, I think, is a way for us to monitor each county, adjust in each county, motivate each county, and really still continue to try to get our kids back in school and try to get our kids participating in extracurricular stuff. And we'll do so, with the smart guidelines and eyes of all of our medical community and all of us. Now, if I could go on real quickly, and I'm going to just go through this real fast, but we now have 3 outbreaks reported in churches in the Cabell, Wood, and Taylor counties, 42 total cases. I remind you again and again and again, you're doing better in the church communities and everything, but continue to social distance and keep a pew in between you and do all the good stuff that will keep us safe. Wear masks, please. From the standpoint of our small business programs, going great. We now have out $8.3 million, and we're going to be coming again with another big announcement from the standpoint of we think we have found a way for our entrepreneurs that aren't employees to be able to qualify. And if that be the case, there's such a large number, we're going to start off with being able to send them, and we'll be doing this the first of next week. We're going to be able to start being able to send them $2,000, and we'll just have to see, how the money goes, and we just want to make sure that we've got enough money to keep everything moving the way we'd like it to go. We've now sent out almost $78 million to our cities and counties. All that's going really good. Everybody just keep sending in your applications, and we'll keep moving there. Our free testing this week, we're in Brooke and Lewis counties, and next week we'll be in Lincoln and Hancock County. Our summer feeding program, remember, we don't want any West Virginian to go hungry, and so we've got 696 sites that are set up. If you've got any question whatsoever, please call 211. I'd like to talk to you just 1 second about the census. They have moved the census date up. I don't know if that date for sure is September 30th or September 15th or 20th, but they've moved it up. We only have a very short rope now as far as the amount of time to be able to get counted. Please get counted, West Virginia. You're still behind. You're still way behind. And absolutely, if you don't get counted, we're just throwing money away. I want to just update you about a veterans nursing home. All the residents at the West Virginia Veterans Nursing Facility, 84 have been tested, and all came back negative, which is great. 183 staff are negative. We're still awaiting 9 additional staff tests, but I want to thank our administrator, Sherry Reed, and all of our staff. Great job. And so with all that being said, I guess the other thing that I have to add is I do know that from the standpoint of percentages today, the state's level is at 2.6, and that is a daily 7-day running average. We're at 2.6 in the state of West Virginia today. As we go forward, the first thing we'll look at is where's the state at? And then the next thing we look at is the county. You will absolutely be regulated or whatever by the county color code as we go forward. That's the guideline we'll have to try to adhere to. Now, but from the state standpoint, we've got to watch that too, because I do know, one of the teachers' unions, the AFT, just came out and said, we're good to go on anything under 5%. So we're in phenomenal shape in regard to that. But we just we'll monitor that, but at the same time, we're going to monitor county by county too. So that's all I've got, and I think we'll keep on going from there.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon, everybody. This is quite a day, as the governor has recounted. We are very committed, and the governor is, to make sure that we are allowing our students and our teachers to go back to school safely. We know that the absence of school and structure for some children results in hunger, results in the lack of structure, results in more childhood traumas, depression, isolation. But at the same time, we also know in the time of COVID, this is a very unusual, once-in-a-lifetime situation. So as we have started to come up with these metrics, and the governor has decided how the state will move forward, we are very much focused on making sure that we can get everybody back into class safely. And as the governor said, as we look at our state sort of gating strategy, that we look at the daily number for a 7-day rolling average of the number of tests that are taken that are positive, we are well below that level of 5%. And that's an important level because that's not only from the AFT, but many states like New York have adopted that same sort of guidance. As we look at the counties and we start to focus on the best information we have in public health, we know that this approach is what the Harvard Institute for Global Health has started related to this scoring system, which is really looking at a 7-day rolling average of new daily cases that are then population adjusted per 100,000 population, so small counties and big counties can be compared equally. And so as we look at this guidance and then start to look at the red, orange, yellow, and green, I think what the governor said is very much true, that we know the single most important element for the success or failure and the safety or the less safe environments for our students, for our children, for our staff, for our teachers, is the health of the community. So what we are really focused on is not only making sure the schools are safe, but making sure the community is safe. And this should really be an incentive to all of our communities, all of our counties, that the safer we keep our communities, wearing our masks, doing our physical distancing, being cognizant that if we travel, we want to make sure that we're being really smart, and maybe we are isolating ourselves when we come back so that we protect others against spreading that if we're asymptomatic or pre-symptomatic. The better our county's health is and the lower the spread of COVID-19, the healthier our schools are. The more we're going to be able to play sports. We're going to be able to get to the things that we love. So this is, I believe, a very safe and innovative approach to make sure that we are trying to balance the need to get our students back in class, to protect them, to protect our teachers, but also to make sure that we are providing very specific guidance that if something is not going as well as we would hope, that we're able to pivot rapidly and with agility and make sure then that we are always doing the right thing to make sure that we are protecting the well-being and protecting the people that are the most deeply involved. In West Virginia, this is one that it's really up to you and up to all of us to get ourselves into the green, hopefully in all of our counties, and the yellow, so that we can go on and do all the things that we are very much committed to doing together. So thank you.
Thank you, Dr. Marsh. Next, we'll go to Clayton Birch, our State Superintendent of Schools.
Thank you very much. Thank you, Dr. Marsh, Governor, Justice. Spending as much time with these experts as possible, the governor talked about how much collaboration went into creating this. And I just want to try to take a step back and talk a little bit about what's happened the last 3 or 4 months. I appreciate that we're focusing in on our superintendents and our school leaders and our teachers. I don't want to leave out our parents and community members. 60,000 of you have reached out to the Department of Education, taken a survey. You've taken surveys for your local communities. We want to make sure that everybody's voice was heard as we put these plans back together. Well, today is August 14th. Those plans are due to the Department of Education today. And it was important for us to have those plans done in a very thoughtful manner, a manner in which I want to reiterate a few things that were said before. Parents had options. We wanted those plans to be in the hands of the local superintendents and the local county boards. They know their communities better than I or anybody in my department knows here in Charleston. And they put those plans together specifically for their communities, both for options for parents with what resources they had, and we're going to see blended, we're going to see in-person 5-day, we're going to see virtual. And that was the goal from day one, to make sure that, one, parents had options. But now as we've gotten close to September 8th and we've worked with all of these experts on the map and the color coding, is now we're targeting specifically how those counties can prepare for September 8th. And the governor went through green, yellow, orange, and red. And, you know, it is posted on the West Virginia Department of Ed's website now. It is something you can go, you can look at, and it will take you through exactly what the governor described. We'll be working with each one of the county superintendents as we go through their plans with them. We'll be working with them each and every day as September 8th gets closer, knowing that if they're in green, they're going to follow our guidance that's been placed and put out for several months. They've got a plan. We know that if they shift to yellow, we know they're going to be working with their community. They're going to be on alert, I think, as Dr. Marsh said, that they need to be paying attention to the numbers. We're going to continue working with our children and families, how to make it safe, how to make it healthy. I think our teachers are going to play a pivotal role, as well as our service personnel, in making sure we're all staying on track. But it's when you reach that orange that the governor and Dr. Marsh described, that it is a heightened community transmission rate, and we've got to do more strict mitigations. And it's going to be a lot of work to work in the community. It's going to be I know that Bernie Dolan and the SSAC are going to follow this map just like the rest of us. It's going to reduce that competition down to practices only, and we're trying to stay out of the red. But once that red hits, it is immediately a closing of in-person instruction. We go to those remote learning plans. Our students are on virtual learning. And I truly believe that each one of our 55 county superintendents, as they develop these plans, we're planning to be ready for each one of these areas. So I cannot thank them enough.
Thank you, Superintendent Birch. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. Not sure I can add a whole lot to this. I will say that these have been incredibly difficult decisions. I want to give the governor credit for jumping out again and being proactive and doing something that's very innovative with regard to trying to get children and teachers into the classroom in a safe way. And that's the goal. We believe that can be done. What we are looking at is incidence rates in communities. And as the governor said, and as Clay said, this is a way to look at counties with regard to the level of disease in the counties, and to give counties and communities the opportunity to mitigate that disease. As community spread becomes an issue, you will be able to follow this on the DHHR dashboard. We will have, as quickly as possible, no later than Monday, but we hope to have sooner, the dashboard providing 7-day rolling incidence rates for everyone to look at as a part of some other changes that we're making. The 7-day rolling average will be on there. The maps we will provide, as the governor said, weekly. We're looking at possibly making those available as quickly as possible. But as Clay mentioned, the difference in community spread and congregate spread, and the governor mentioned, is different. So we are looking at adjustments there to try to make sure counties are treated fairly with regard to, and the same with regard to that community spread. congregate care facilities such as prisons and nursing homes, those individuals do not move out throughout the community, so they are treated differently. So we are making adjustments to those numbers to reflect that. We will have those maps available as quickly as possible. I will ask Dr. Amjad. She has a couple of things to say with regard to the process itself.
Good afternoon. I'll make just 2 announcements and then talk about the school system as well really quick. But Mercer County did elect a health officer, and they'll make those announcements. But I did want to bring that up because we were following them very closely, but they did pick a health officer, and they'll probably talk about that more down for themselves. But regarding the school system, we have been working very hard with that. And a lot of people do want to know the process of if a child does contract COVID-19. The DHHR does have guidelines for COVID-19 outbreaks in school, and that does go up on our website. It's laid out pretty specifically on our website, and also the Board of Education will have that. But to briefly describe it here for everyone, if a child does have COVID-19 while they're at school, the school will notify the local health department as well as the parent. The child, no matter what time of day it is during the school, would be taken out of the school system by the parent. And if the child is in the classroom, all the children in the classroom, as well as the teacher, would be notified with the local health department for contact tracing. But those questions do come up a lot online to us personally, but we do have a guideline that's written out. We've reread that several times. We've followed CDC guidelines, but that would be on our website. I did want to bring that up, but those are the 2 things I just wanted to mention briefly here, but we're open for questions later on as well.
Let me add one other thing I should have mentioned. The governor talked Wednesday, I believe it was, about moving quickly to open nursing home visitation back up. We're also looking at this system to be part of that approach for nursing homes. And our local health officers out there, we want to make sure they're a part of this process as we move forward. So we'll be working with them in terms of this information as we roll it out here. Thank you.
All right, thank you both. Next, we'll go to Bernie Dolan, the Executive Director of the West Virginia SSAC.
Good afternoon, and thanks for allowing us to be a part of this. The SSAC has worked collaboratively with the governor's office, the state superintendent, with the health departments, trying to come up with the return to play, return to game, and do it safely. We started this journey back in June, where we began to bring the kids back in small groups, small periods of time, and we've increased the length and the intensity throughout the summer. Our coaches and administrators have shown that they can handle and they can follow the guidelines. We think we've done it very well, very safely. As you notice that our color code works hand in hand with the color code for the schools. Extracurricular activities are just that, extra. So we think that this system will allow communities to get behind the initiative to move the color closer to green and to finally get to green. There will be incentives for communities to move. And we think that with our coaches and administrators and players all leading the way, we think we're going to head in the right direction. We will work with our administrators to deal with the limited spectators as we get into the yellow and green that will allow spectators at the games. So we think it's a great model. I'm on a call weekly with the Section 8 people, Section 2, which is our 8 surrounding states, as well as a National Federation weekly call, and don't know of any other plan that's out there that's like this, that incentivizes the community to get better, not only to be healthier, but allow more activities to go on. So I thank the governor and everybody for allowing us to participate.
All right, thank you, Bernie. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. To highlight a couple of key points, our PPE levels in the state continue to be in a good position, and we continue to obtain more, as well as begin to produce more of our own PPE. Significant number of disinfection missions are going on with targeted efforts on our nursing home facilities, as well as helping our first responders, law enforcement agencies, so that they can maintain the level of service needed by our citizens. We continue to provide technical support to facilities, particularly the congregate settings, related to airflow, sanitization, and other best practices. In addition, the governor has put an additional emphasis on us working on efforts with DHHR to continue to aggressively test across the state of West Virginia. That includes producing additional test materials internally, as well as improving lab capacity capability across the state. If you look at us related to national level of testing, West Virginia continues to be in the top of across the states with the percentage of testing, even when you factor in those folks who have had multiple tests. The governor's directed us to continue to be aggressive in this effort, and this will be part of the key to our success in the models that were laid out to you. Thank you.
Thank you, General Hoyer. Our first question today from members of the media is from Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. This is more of a clarification question, but I've heard it said both ways, talking about updating this map daily and updating this map every Saturday. I'm a little confused on that point. Are we going to be updating this map daily, or am I misunderstanding that these are two different updates? Can somebody explain that a little bit further? Thank you.
Let me try to make a stab at that, and then I'll pass to anyone that wants to talk about it. But Stephen, here's the dilemma that we face. If we go in a situation to where we're updating daily, and we go and a county drifts in from yellow to orange, at that point in time, we're supposed to stop and go to practice only with our game situation in regard to sports or any extracurricular activities, Now, so what we've done is we will be updating daily, and everybody will be able to see it. But we will also do a weekly update, and if you enter the week on Saturday night on a yellow, you will be able to participate and play games until the following Saturday night. But if at any time during that week when we're continuing to update, and you'll see the update daily, you'll see it. Let's just say that hypothetically, that on Wednesday, I'm in Greenbrier County, and Greenbrier County goes to orange on Wednesday. Well, I know that I'm in real danger of losing, the ability to play competition and everything. Of course, we're going to work really hard on it, but then on Saturday night, it comes out orange. Now, at that point in time, until the next Saturday, I can't participate in competition. Now, so we're going to be updating daily. You'll see it every day. But what we won't do is this. We won't get in a situation to where on Thursday, if the dashboard comes out and it shows you with an orange color on Thursday, and we have people already on the way to Greenbrier East High School to participate in a football game, and all of a sudden Greenbrier County has moved into the orange category, then we've got a whole mess as far as being able to how to handle the transportation, how to handle all the scheduling, everything in the world that goes on. So that's why we try to do this. You will be updated daily. You will see it every day. And the only time that it really changes and flips for our extracurricular stuff will be on Saturday night. Now, for the following week. Now, the other thing, though, if we go red, at any point in time. At that point in time, the school's shut down, the sports are shut down in their entirety. Everything shuts down right at that moment. We don't wait till Saturday, we shut down right then. So that's basically what it is.
All right, thank you, Steve. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. As you've acknowledged, it's a fairly complicated plan with a lot of moving parts. Could you give us a more bird's eye view of the leadership methods to come up with this plan? And what I'm wondering is, were there meetings? Was it you as the chief executive saying, well, this is what I envision, asking Dr. Marsh and others, Secretary Birch, Superintendent Birch, how would this work, kind of cobbling it together until finally it was something that made sense to you? And at what point did you feel like you had a finished product where you could say, all right, well, this seems like it'll work, let's present it to the public? Thank you.
Okay, Brad, I'll try this. First and foremost, you know, we have had so much collaboration here, it's unbelievable. And it's really good. It's been really, really good. Especially from the standpoint of all the feedback that's coming from our county levels, whether it be the county health departments, whether it be the county superintendents, all the plans that have been in motion on how, I mean, just imagine if you were a county school superintendent and you were putting together a plan on how you could go back to in-school teaching, how you could go fully virtual, how you could go to a hybrid, how you could go to taking care of all these kids and their meals and all the support services and everything. It is an absolutely monumental task and all the job that all these people have done. And all that information is flowing, and it's flowing to this panel that's up here, as well as our DHHR and Dr. Amjad and everything, and all those that are working it. And then it's all feeding to me nonstop. Now, how I go about trying to do any and everything you can do is just this way. I first try to write down, if we could have utopia, if we could have what we wanted to have happen in the very best way, what would it be? Well, it would be able to go back to school and it be super safe for the kids, our teachers, our service personnel, and everybody. That's exactly, and go back to being able to play sports and it be super safe for everybody involved. Now, you got a lot of curveballs in to work through and a lot of wickets to go through to be able to get to where we can do that as best we possibly can. So now we got a plan. Now we got a plan that says, if you're in a green county, we're ready to go. You know, just think about it. We have counties within the state of West Virginia that almost have no cases. Well, for crying out loud, you know, I had a superintendent come up to me just the other day, and I'm not going to tell you the county and everything, but he came up to me the other day and said, listen, Governor, we're in such a rural county, we don't have any cases. We don't have really anything other than to do for our kids and everything. We want our kids to come back to school. And Governor, you know, if we don't have any cases here, you know, our parents want the kids to come back to school. And Governor, you know, if we would happen to go 100% virtual, Governor, we're in a rural county and a lot of our kids or parents or whatever are going to have to drive a long ways when, Governor, we don't have any cases here and we need to just go back to school. Well, you see, you got that, and you got the situation with real hot spots where we're red, and so you've got to absolutely do different things in different counties in a different way. And so the net of the whole thing is this has been the culmination of a ton of work from a lot of people, and I congratulate everybody. I mean, this is a heck of a plan. Do we have to know that we've got to be light on our feet and be willing to pivot and everything? Sure. But this is a plan like West Virginians do over and over and over. You see, we have been the first in the nation, and here we go again with a plan that motivates our people to try to do better than they're already doing, and they're already doing great. It motivates our people. And not only that, it gives us the opportunity to really have a metric, a scientific mathematical number in order to be able to measure us, that leads us and dictates to us what we're going to do and how we're going to do it. So anyway, that's how it is, Brad, as best I can tell it.
All right, thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Can you talk about how counties will be prepared and how they're preparing to be able to flip on a dime if a county would go red? Also, if a county does go red and things are immediately shut down, what time will parents know that the day before so they can start planning ahead?
Okay, I'm gonna defer to our Superintendent Clayton Birch.
Thank you, Amanda. So the plans that we're bringing in, that is one of the things we've asked the counties to do is, again, being very clear with parents the options they have first and foremost. In-person, blended, virtual, and that's really where their target has been. However, each one of these counties have been asked to have a contingency plan. That is, if they go red and they have to go and resort back to remote learning, they are ready to do that. This is not like March when we were in a panic state, when we had to make a decision to close. This is very different. They've been planning for months. And not only that, the time, I know we've heard the governor use the term, we bought ourselves time to better prepare. What I'm seeing is each one of those counties, as part of their return plan, they're spending a lot of time with their teachers and service personnel preparing for September 8th, but also preparing for if they happen to go red. They are much, much better prepared.
All right, thank you, Amanda. Next, we'll go to Ryan Quinn with the Charleston Gazette-Mail.
Thank you. Two clarifications, and then I'll get to the question. One is the metric for the color codes the 7-day rolling average of new positive cases per 100,000 people? Is that the metric? And then what does orange mean for in-person instruction? I believe, Governor, you said at one point that Mingo and Grant, which are orange, would be fully remote if they opened today. And they would have to be fully remote. Yet I thought that orange only affected of sports, and it was red that affected that put everybody on fully remote. And is this based on the Harvard Global Health Institute's map? If so, why did you modify it, especially to make the cutoff for yellow 8 new daily positive cases instead of 1, and the cutoff for orange 16 new daily positive cases rather than 10?
Okay, Ryan, let me start, and then I'm going to pass to Dr. Marsh. But to clarify Mingo and Grant counties, here's what we decided. We decided that any county that was red, naturally 100% virtual. Any county that is orange before we start, we don't need to let that county start and just be ready to fail. And so if you are orange before we start, you're going to have to go 100% virtual until you get down out of the orange. And so that's the only 2 counties that we have that are orange today under these new guidelines and all that. And so we're, Logan, we're very worried about. Naturally, we're worried about all of our counties, but Mingo and Grant, we need to get them down out, back in the yellow and back in the green. And so Dr. Marsh is going to be able to talk to you more about all the specifics and everything, but Dr. Marsh.
So thank you for the question. The answer to the first part of your question is that we are using the 7-day rolling average of daily new cases that are identified per 100,000 population as the rolling average metric. So each day it updates to the previous 7 days. As far as the inspiration for the model, as you rightly point out, the Harvard Global Health Institute and their approach is the sort of the inspiration for what we did. The challenge with that model, though, is that's never been validated on small states, and it's really an agreement of public health experts. So as we talked, we did not want to create something that wouldn't be effective for very small population counties, which is the reason why we work with our public health experts and started to adjust some of these frameworks so that we have these new metrics. And the public health experts in our group that we rely on are closely monitoring with us the way that we're applying these metrics, some of the issues the governor had pointed out around the congregate setting versus the community setting. So we believe this is a proper model for the state of West Virginia.
All right, thank you, Ryan. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a question for Dr. Marsh. Doctor, we've heard from the SSAC about the importance of playing. We've heard from the governor about the importance of playing. I'm sure you share their opinions about the importance of playing games. From a medical standpoint, can you walk me through how playing football is safe for students when they're on the lines lined up 6 inches apart and exchanging bodily fluids throughout the entire affair? Sweat, spit, in some unfortunate cases, blood, etc. So can you go from a medical standpoint what your recommendation was as far as West Virginia playing football this fall? Thank you.
You go, Governor?
Sure.
Okay. Well, thanks, Kenny. You always ask really straightforward, easy questions. I'm kidding. But it's a good question. You know, I think that like everything else, there is there's nothing in today's world without some risk and benefit. And we know the benefits of organized athletics. We know that it's good to have people in better physical condition. We know it teaches the lifelong skills of discipline and teamwork and resilience and all that. But I think you're raising a really important question, and this is a different time. And what I would say and what I go back to is really how we practice in other disciplines like medicine. And in medicine, what we are obligated to do as care providers, and I think that as representatives and leaders of the state, I think we're obligated to make sure that we are focused on 4 real principles. The principle of autonomy, which is the principle that each person should be able to make their mind up for themselves with the appropriate information and with the ability to make that decision. If you're a minor, certainly with your parents. The second one is beneficence, which is that we're doing things to try to create good and not try to do harm. Number 3 is that we are just, that we are applying this evenly. And the fourth one is that we are providing informed consent, which informs people of life-threatening complications and usual complications. And I think it's our obligation as leaders, as coaches, as schools, as our, the governor, to make sure that we are instructing all of the people involved that they need to understand the risks and benefits of participating in the sport. And we have laid out a plan that we hope will make an impact on community spread, which is an important consideration of safety and non-safety in this time of COVID. But I think that decision should really be left, as long as the community control is appropriate, to parents and students working with the coaches and the schools to decide what risks and benefits that they are willing to take in this era.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, could someone explain why we're going with new daily identified cases as opposed to total active cases in a county? Like Kanawha County right now has over 300 active cases, which I think by this metric wouldn't make them red, but that sounds like a lot of cases. Could you just explain that for me, please?
So that's a good question. Again, we're really going off of the Harvard Global Health Institute model, and this is a model that's really generated by public health experts. And the rationale is that as we go forward and we count this, it really does account for the number of new cases. And in big counties like Kanawha County, where you have more people, then we want to be careful about not reflecting things just on a quantitative measure of county to county, because some of our counties are very lowly populated where other ones have larger, much larger population centers. So the idea behind this is we actually do this at a metric that can change as the rate of spread, new cases on a daily basis, are impacted, which then reflects more concurrently the activity and the status of the county. If we wait for the number of cases to be cleared, the active cases, then that would generally be a minimum of 14 days to see any change. And this model changes things much more rapidly and does it on a population adjusted basis.
Come back to me just 1 second, please. And I think this was Charles, is that correct? You know, Charles, keep in mind this too, Charles, you know, we are leaving so much of these decisions to the local people as well. I mean, it may very well be that, you know, from the standpoint of if Kanawha County were green and they wanted to go 100% virtual and everything, they have the right to be able to do that.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and staff. Governor, I'm going to borrow one of your colorful phrases here in my question, and I promise I'm not trying to start a food fight here, but I did consult with a number of legislators this morning from both parties, and all of them expressed frustration that they feel they're being left out of the loop. They're not being consulted on some of these things like what was announced today. Your thoughts?
Well, Mark, we're just, you know, only thing I could possibly say is we're trying to keep everybody involved and notified and abreast of every decision that we're trying to make, you know, along the way. We said, you know, 14 days ago that we would be coming out with a color code situation. We'd be coming out in the next 10 days and everything. Today's the date. You know, we got to announce with the color code and everything that the experts came out with and everything. This is not really a decision that I mean, this decision is a decision that comes from the experts that are leading us in the field of education and in the field of medicine. And that's all there is to it. I mean, at the end of the day, if we want the very best decision that we can possibly make, we better absolutely be listening to these experts to be able to tell us.
All right, thank you, Mark. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. I have a question about churches. We had a lot of people asking why aren't the churches that have outbreaks being, like, specifically being said where they are and what church it is. So I was wondering if you could explain your reasoning for that. And also if someone could explain why there are maybe more outbreaks in churches than, say, Walmart or other stores or places where people are congregating.
Hey, Bill, you're going to have to answer this.
Yes, sir. This is Bill Crouch. Yes, we have categories that we're looking at trying to make public with regard to identification of the outbreaks and the type of outbreaks it is. We don't publicize all of that information because of confidentiality. The local health departments and local health officers sometimes make that information public, and it becomes public through the press. The state, because of confidentiality requirements, does not routinely provide that type of information. But it's a good question and one we've wrestled with in terms of how to get better information out to communities in terms of the type of outbreaks we're experiencing. We, as I've talked about before, we started out with a lot of outbreaks in nursing homes and moved to churches. Now outbreaks are all over the state, from again, as I've said, golf courses to baby showers to weddings and funerals. So there are quite a number of groupings there that we are looking at trying to maybe make public so folks have a little better idea in their county and their communities of what's going on.
I'd like to add to that too. I've talked to the West Virginia Council on Churches and Bishop Steiner Ball here in Charleston, and a lot of the church members did feel like having their name publicly mentioned in the media did not help them. We've reached out to a lot of them to see how we can help them find ways to do their services online, find out ways they can hold services safely, whether it's through masks or other mitigation efforts. And a lot of it is private. They did feel like they were being stigmatized by the media. So some of those things are private, and if it needs to be out there, it could come out by itself. But things like that don't need to be stigmatized or anything. But we're trying to help them and help their community because it is something personal. They do want to worship, and we don't want to have it, given a different light. But we're trying to help them find ways to worship safely, and that is something we're trying to work with them, not make it a bad thing for church members.
All right, thank you, Taylor. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, everyone. My question is about, I guess the concentration of deaths across the state. A colleague of mine pointed out to me, I believe it was yesterday, that if you look at past the 100th death, many of them are located in the southern part of the state. And I'm just curious if we have any idea why that is, one, and two, is it a matter of hospital and medical resources in that part of the state?
Okay, I'll answer that real quick, and then I'm going to come back to Dr. Marsh on the last question. He wanted to add one thing to the last question. First and foremost, I've said this over and over and over. Everyone needs to know that this situation happened in the South, whether it be Florida or Texas or Arizona, and then it went to Mississippi, Alabama, and then all of a sudden it was in Tennessee, and then all of a sudden, voila, it's in Kentucky in a great big way. Now, in addition to that, over and over and over, we see that the problem that has happened is we West Virginians are going on vacation, primarily Myrtle Beach, and we're bringing it back to us. So from the standpoint of the southern travel and everything, that's what's happened more than anything. We have brought it back to us and everything. That's tough. I don't want to be critical of anyone, that decided to go on a vacation or whatever like that. We need to be super safe if we choose to do so, especially Myrtle Beach. So that's the reason. The reason is real simple. This thing is migrating from the south, but way more importantly than that, two words are the reason to this problem: Myrtle Beach. Anyway, Dr. Marsh,
So I just wanted to make two comments, if I can, briefly. One is that one of the reasons why churches have a higher incidence of spread is because of singing. And we have to be really careful as we are with each other and sing that we do need to be appropriately physically distanced away, and we need to wear our masks, because we know that there are super spreader events. The one in Washington is the most well-known, where during a 2.5-hour choir practice, one person infected 56 of 62 people. So that is a reason why churches have more risk. The other thing, in addition to what the governor said, clearly travel-related problems, when we started this, we said that the Kaiser Family Foundations rated us as the most vulnerable state in the country. Well, the disease is now at the part of our population that has the most health issues. And so as we see that happen, we know that there's a higher risk of bad outcome and more severe impact of COVID-19 on our state.
All right, thank you, Dave. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, you like to use the word pivot. I'm more partial to a drop step, but in regard to pivoting, the school nutrition program, and perhaps this is for Superintendent Birch, the cafeterias in the schools are going to be under a little bit of pressure, especially in a hybrid situation or having the ability to switch menus if there is a shutdown and going to all virtual. How is that being handled? Are they going to have enough different kinds of food on hand in order to feed the kids?
Superintendent Birch, you're going to answer.
Yeah, that had to be part of their plan. So when those plans come in, what you'll see is that some counties are looking at reduced capacity for their cafeterias when they're on site. Some are looking at eating in the classroom. So they're adjusting that when the school was in person and live. But remember, what we said was they all had options. So each one of those families who chose not to do in person, that chose to go virtual, they also have to make each one of those meals available to them. Now, General Hoyer and I have been talking quite a bit about if they go red and go full remote. And that is, we have to be ready, and the counties have to be ready to provide meals to all students when they go remote.
All right, thank you, Paul. We have one follow-up question from Ryan Quinn with the Charleston Gazette-Mail.
Thank you. Do any colors below red force implementation of any more mandates regarding in-person schooling, like a requirement to wear masks in schools and on buses, whether they're social distancing or not? It seems like nothing below red means anything for in-person schooling. And so I'd like to know if any more mandates are put in for yellow or orange.
Secretary Birch, go again. Or not, or Superintendent Birch, I'm sorry.
I'll begin, and I know that Dr. Marsh or Secretary Crouch may want to jump in. So, Ryan, there are additional requirements. We looked at orange. We've said that orange is, especially orange, is at critical stage. So what you'll see on the document that is posted is that we did go back and we required grades 3 through 5 in congregate settings, riding the bus to wear masks. Grades 6 and above, you will see that'll be on there. We've also looked at beyond extracurricular and athletics, but activities within the school being restricted when there's groups coming together. But I think, Dr. Marsh, I think that might be.
Well, part of President Trump's instructions from the White House of going back to school includes a lot of education of not only the teachers and the staff, but for parents and students. And we are encouraging at all times students that are able to wear masks, to physically distance. There's instructions for teachers about trying to keep smaller groups of students together, so-called cohorting or podding, so that if a student in that group becomes ill or gets COVID, that it would limit the spread to the rest of the class or the rest of the school. So there are a number of best practices that are already in place. And I think that the key will be at the local county levels of the school boards to make sure that part of the plans are to appropriately and in detail instruct and educate all people in the schools about the best practices, hand hygiene, mask wearing, physical distancing, cohorting. Those things are really important to prevent outbreaks in this time of COVID-19. So thanks for that question.
Governor, if it's okay. We also don't want to minimize the role of the local health officer and the local health department out there. They will be working, as they always do, with counties and with schools in terms of mitigation of risk and in terms of efforts that should be put in place or could be put in place in a county to mitigate this disease. So they still have a role in this, clearly have a role in this, and will be part of that under the yellow and in terms of possibly more testing, and under the orange in terms of some other efforts that could be taken in the community and in the county. Thank you.
All right, thank you. That's all the questions we have for today. Governor, I'll turn it back to you.
Well, let me try to wrap this up by saying just this, that again, I can never be more grateful than what I am right now to all these people that we call experts and all the people that are feeding information through and to them. You know, from the standpoint of, you know, Bernie Dolan or Clayton Birch or Dr. Marsh or General Hoyer, I mean, what an incredible work that they've done. And I don't say that lightly. You know, I don't blow smoke at anybody. They've done phenomenal work, as well as all the people that are putting this together and feeding the information up through all the different ranks to them. You know, we don't ever forget the people that are truly on the front lines, whether it be our local healthcare people, all of our first responders, all the guard, everybody. You know, but in addition to that, we've got to remember our superintendents, all of our teaching community, all those that are there on the front lines in our counties that are feeding us information and putting together plans, and they've done great. Now, let's just think about this just 1 second. What are you going to do? I mean, when it really boils right down to it, you know, if we're going to decide that the best alternative is you've got kids that we haven't seen or nobody's laid really eyes on them maybe in 5 months, and all of a sudden, you know, if we just left it that way, we'd have a lot of real problems, would we not? We got 30,000 kids in special needs. We have so many different ramifications of hunger and meals and love and appreciation and just support. There are so many aspects here, it is unbelievable. And so what we have tried to do with All In Us is we have tried to find a way that is the safest possible way that we can do it, and continue on with education and continue on with trying to do goodness for our kids, fairness and goodness for our teachers and our service personnel and all. Fairness to those that we may just lose falling through the cracks that are some way clinging on from the standpoint of athletics. So many different aspects that you're trying to look at here. And let me tell you, I mean it when I say this is the greatest state with the greatest people. It doesn't surprise me that here we come again with a plan that nobody's really thought of, and done it in a way that we can motivate our people, motivate our counties, really, and take care of our kids, do everything under the sun, while we have a cumulative positive rate of 2.40. You know, we have a daily 7-day running rate of 2.6. You know, other states would kill to have those levels. We absolutely are a good state with good people that's absolutely produced a miracle after miracle after miracle. I want to say one last thing. For those that are on the outside, you know, whether they be in one party or another party, we should all first and foremost be West Virginians. Every day I come here, every day I tell you what we're going to do. Every day I solicit all the input and everything that you would love to participate. My door is always open. Our door at the governor's office and all of our doors are always standing there saying, come on, just tell us what you think. Tell us what you want to do. Give us an idea. We listen. We absolutely listen always. Now, from the standpoint of sitting on our hands and not doing, well, you're not going to catch me doing that. That's all there is to it. We're going to keep doing stuff, and we're going to keep moving forward, and we're going to keep doing the very, very best we can possibly do. And so from the standpoint of just sitting back on the sidelines and maybe saying, well, why not, you know, do this and that and everything else? The doors are open. We beg you to come and give input. The input we're gathering, the net is really wide and everything. But at the same time, you know, don't sit there and absolutely don't think that this train is not going and it's not going north, because that's what I do. And that's all there is to it. Now, we got some level of pushback in the same thing in regard to the CARES money, did we not? And at the end of the day, what happened was, all of a sudden, lo and behold, we were ranked 4th in the nation as far as expediting the CARES money as expeditiously and as fast as we possibly could. This state's doing good stuff, and these experts have done a whale of a job, and I'm really, really proud of them. So thanks again to everyone here and all those that are out there that are doing it, and especially thank you, West Virginia.